Hey Josh, so good to see you today.
You as well.
Thank you for coming down on a Sunday afternoon when it's blazing hot lava outside.
Anytime.
So wanted to touch base with you, give a little bit of an idea of your life, your CrossFit journey before you came here, because you moved here how long ago?
About a year ago.
Okay, so yeah, you've been here about a year. And we've been excited. I remember, I think probably the first 1 or 2 times when you came in, you're like, I'm going to be moving here. And I was like, oh, cool. But tell us a little bit about your CrossFit journey.
Sure. So it probably started probably my second to last year of residency.
Mm-hmm.
So I was working unbelievable, crazy resident hours, like 80 hours a week. And I remember getting really soft, and I just was thinking I've got to do something to get into shape. And I looked at trying to do a CrossFit gym, but nobody had. I really needed to do like a 5 a.m. class, and there was nobody that did 5 a.m. classes anywhere remotely near me. So I just started going on to the CrossFit website, and I would just see the workout of the day, and I would do it. And if I didn't know what cleans were, I'd watch a few videos and start really slow and light, and kind of just learned on my own.
Wow.
So yeah, it was quite the experience. But it was fun because I liked it because it was something new every single day.
Mm-hmm.
And I don't know, it was just really fun. And so I tried to do that like 4 or 5 days a week.
Mm-hmm.
And then when I got out of residency and took a job in New Mexico, I had a lot more time. And there was a local CrossFit box that was about 2 or 3 minutes from my house. It was fantastic. And then that's where it really started, where I got really introduced to CrossFit.
Okay, so what was it like your first CrossFit workout inside a box?
Inside a box? It was really neat. There was probably like 12 of us, and I really didn't have a great idea of what I was doing.
Mm-hmm.
And I look back now at some of the weights and some of the things, and of course I look back and I'm like, wow, I've made a whole lot of progress since then. But it was great, it sounds morbid, but it's really fun to suffer with other people.
So tell me a little bit about what your job is in your life. What do you do for work?
So I'm a urologist, and I know a lot of people don't exactly know what a urologist does.
Mm-hmm.
I mean, before I became a urologist, I had almost no idea, so I don't blame people. But I am a surgeon for the urinary tract, so I do kidney stones, kidney cancer, bladder cancer, and I treat a lot of incontinence, both male and female.
Okay.
I think the biggest aspect that people don't realize is that close to half of my patients are women. So
really? So tell me a little bit about what you see, because as a healthcare professional, mm-hmm. what you're doing is you see people and results of perhaps lack of exercise, and also people who maybe are exercising. Tell me what you are noticing as a healthcare professional.
Well, I can definitely see the effects of long-term inactivity as far as diabetes and high blood pressure, and then specifically with what I see is incontinence, so leaking urine when you don't mean to, and it's amazing how many studies have shown that losing X amount of weight, some studies it's as little as like 10% of your body weight, can have huge ramifications as far as treating your incontinence. And if I can tell people, lose 20, 30 pounds, and you can stop leaking urine, I think that's a pretty good incentive.
Yeah, I think people want to not have that problem.
Exactly.
I think that there's even some good videos about the impact on urinary tract health.
Oh yes.
Yes. So you've been doing that for how long now?
So I got out of residency. It's been 4 years now.
Awesome. So do you have conversations with your patients about health?
Oh yeah. I think. I guess I could always do better. A lot of my return visits, I don't necessarily harp on this much, but any new patient that I see, kind of no matter what I'm seeing them for, I tie in some type of like diet and exercise, mm-hmm. Because I think it's absolutely crucial for overall health, and,
mm-hmm.
and it's amazing. They've even done studies looking at just diet and exercise, and they say you could probably replace just about any pill that we can give you with exercise and a good diet. So anywhere from kidney stones to cancer prevention to just overall, better health, so that you can withstand, all these trials and trials of life that I think it's my responsibility to at least bring it up in a conversation.
Yeah, I think it's awesome that you're willing to have those they're kind of uncomfortable conversations, aren't they?
It is, and there's definitely, and I try to be as tactful as I can about it, but there's definitely times where I've gotten a few patient complaints because I sometimes can be maybe a little more blunt, and telling people that, hey, you're overweight. If you lost this amount of weight, I think you'd be a lot happier.
Yeah, I think actionable steps is really so important. And one thing I thought about was, what's one piece of advice you give in terms of exercise to your patients?
So I usually try to give them at least one piece of advice and one for like diet as well. I mean, it's simple. Hopefully they can at least think about it. But the exercise piece is do something as often as you can to basically raise your heart rate enough so that you can't carry a conversation. If you can get on a bike, on a stair climber, do the stairs at your home, whatever it takes to get to the point where you can't, you're struggling to carry a conversation, then you've done good. That type of increased metabolic activity is much better than sitting on a bike for 30 minutes and hardly breaking a sweat. And then a lot of times with diet type stuff, I usually tell patients that if you could just increase your protein intake, a lot of times that will help curb some of your hunger, and you're going to be less likely to eat sugar and carbs. And I think that's where you have to have a starting place. So I usually tell patients those two things. Just work on that.
Yeah, education is so important, and I think you and I talked briefly before this about even in our classes, the thing like what is like the after effects of just coming and doing a workout. What's something that or you notice even for you and your kids, like doing CrossFit or doing a workout? What happens after that?
So for me, and I think it's really well studied, you have this increased sense of well-being. So as far as depression, anxiety, it's great for. We've even looked at doing studies, or there's good data that shows that doing a nice workout like that can help you study better, helps your focus. It really does wonders in so many aspects of our life.
Yeah, I think I'm really excited to hopefully help members feel even more like it's not just that you came into the workout. There's actually so much other aspects outside of the box that makes an impact. So, and I feel like there's a lot of areas that I want to have conversations with you about. But what's something that you're working on for yourself? Like, what's a goal you're pursuing right now?
So right now, I'm working more on my endurance aspect of it. So I've been doing a kind of more running program. I generally hate running, but it's something that it's a great way for fitness because you don't have to have any equipment and you can do it just about anywhere. So that's why I'm really focusing on it. But I would really love to get my mile time below 6 minutes.
Okay, super. So hopefully on that day that you get that, I would like to see a post saying accomplished that goal, check mark.
That's right.
It's pretty cool to see people like chasing their like next steps. I definitely would feel pretty cool if I got a 6 mile run. I have lots of other questions, but I think this might be a good like little snippet of time, and I hope that we could have another conversation sometime again soon.
Absolutely,
anytime.
anytime.
Thank you so much, Josh.
No worries.